Now, for the complication based on the hyperoxia, you need to know that what generally excessive oxygen. You have to know that what how does the question is how does hyperoxia result to damage of the child, is it of the neonate? Hyperoxia can result to damage of the neonate by two mechanisms. One, increased pressure. There is high pressure, is it clear? And two, via vasoconstriction mechanism. So those are the two major mechanisms via which hyperoxia, and also hyperoxia can result to reduce carbon dioxide release. Is it reduce carbon dioxide release? So those are the three major mechanisms via which hyperoxia can result to complications. Is it clear? It can result to complications via increased pressure. It can result to complications via decreased carbon dioxide release, and it can result to complications via vasoconstriction mechanism. So those are the three major mechanisms. Now, the first mechanism is via increased pressure. Via increased pressure is going to result when there is excessive pressure at the level of the lungs. It's going to result to what is called a pneumothorax. Is it clear? It's going to result to what is called pneumothorax, and you need to know that what pneumothorax is divided into two. You have primary pneumothorax, which is generally spontaneous. Is it clear? Pneumothorax, which is generally spontaneous, and you have secondary pneumothorax, which is from something. It can be secondary to trauma, it can be secondary to hyperoxia from excessive oxygen supply. Is it clear? So those are, you can have pneumothorax in this child. If you have a child who is asphyxiated and then later on he has pneumothorax, meaning that one chest is much more increased or inflated with hypertympanism of that side, it means that there is already a complication of pneumothorax there. Now, in the second complication, we have hyperoxia. Is it clear? In hyperoxia, we are going to have a decreased carbon dioxide release. Is it clear? And when you have decreased carbon dioxide release, you are going to have a reduced respiratory acidotic compensation. You need to know that generally, when you have beta asphyxia, you have acidosis, and carbon dioxide has to be released. Is it clear? With a rapid respiratory rate in order to reduce the hydrogen ion inside the blood by Le Chatelier's principle, as we have seen from carbon dioxide plus water producing hydrogen ion plus hydrogen carbonate ion. Is it clear? The release of this carbon dioxide is going to cause the hydrogen ion, which is high, to shift the equation backward, and then it's going to release to more carbon dioxide and reduction of the hydrogen ion. Is it clear? So if there is hyperoxia, meaning that there is no, the pressure is excessive such that there is no carbon dioxide release, there's going to be an increase in acidosis. Is it clear? So it's going to result to an increase in acidosis. There is no compensation mechanism for the metabolic acidosis. Now, the next one we have vasoconstriction. Now, for vasoconstriction, we need to also evaluate the fact that what when you have vasoconstriction, the hyperoxia can result to vasoconstriction of the local aspect and systemic vasoconstriction. When you have local vasoconstriction at the level of the lungs, you're going to have a disease later on in lives of these children, which is called a bronchopulmonary dysplasia. Pulmonary dysplasia. Bronchopulmonary dysplasia occurs because of local vasoconstrictions. When you have local vasoconstriction, it's going to result to destruction of this tissue and then result later on in life in bronchopulmonary dysplasia. And then the next complication is going to be systemic vasoconstriction. If you have systemic vasoconstriction from hyperoxia, generally the part that is affected is the retina. And that is called a retinopathy of the newborn. Retinopathy of the newborn. When you have the blindness of the newborn, who are asphyxiated, generally is a result of hyperoxia. So those are the different elements. So after visualizing this pathophysiology, you now visualize the pathophysiology with a reduced breastfeeding.